Another very exciting area of development is that of something called chemotherapy sensitivity testing. I work with a company called Champions Oncology, and they have a very novel setup indeed to be able to determine the most appropriate chemotherapy combination to treat the cancer. What we do is we take a sample of the patient's tumour, and that can be taken at the time of surgery, so there's no additional procedure at all. So when a patient has an operation for their cancer, to have their cancer removed, we take a sample of the tumour, and that tumour is then grown into mice, and they are specialised mice that have no immune system. So because they have no immune system, they cannot reject the foreign tumour that's been implanted into them, and the tumour can then grow in the mice. It's a fairly complex and time-consuming procedure, which can take between 6 to 8 weeks. But essentially, the patient's tumour is grown in the mice. And once we have enough samples of tumour to test on, we can look at a panel of chemotherapy drugs. We can select the most appropriate drugs for any particular cancer type. We can also look at new and promising drugs as well, and we can test those drugs against the patient's tumour in the mice to get an in vivo, a live model of whether the patient is likely to respond to those drugs or not. So once we have the results of those tests, we can then go back to the patient and say, we have chemotherapy combination A or chemotherapy combination B, which we think has an excellent chance of working because they've been tested on your tumour growing in the mice, not somebody else's tumour, not a mouse tumour. They've been tested on your tumour in the mice, and we have seen a response. And there is over a 90% correlation between a response to the tumour in the mice to chemotherapy and a response in the human setting. So it really represents a very exciting development, because one of the most frustrating things about chemotherapy is I can put a patient on chemotherapy, we use our best guess, but we don't do a scan. It takes several weeks before we know whether the chemotherapy is responding, and that might be too late for some people. And they may end up getting toxicity from a treatment that's not really working. So really, I think this represents a huge advance, and again, it's going to move forward into the clinical trial setting in London, in several hospitals in London. We are looking to set up some clinical trials looking at this mouse-directed therapy against standard chemotherapy within the next few months.